When you think of a heart attack, the first image that comes to mind is probably a man clutching his chest. But here's the shocking truth: heart disease is the #1 cause of death among women globally. Despite this, heart attack symptoms in women are often missed or misdiagnosed, leading to dangerous outcomes. This gender gap in diagnosis, treatment, and awareness needs our attention, and today we'll explore why it exists, what it looks like, and what women can do to protect themselves. The reality of heart disease in women: heart disease isn't just a man's problem. In fact, women are just as likely, if not more likely, to die from a heart attack. According to research, nearly 1 in 5 women dies from cardiovascular disease. And yet, both women and medical professionals often overlook the symptoms. Why does this happen? There are several factors at play, including differences in symptoms, biases in medical research, and social stigma around women's health. Different symptoms in women versus men: the classic symptom of a heart attack, a sudden, crushing chest pain, is most commonly associated with men. But women experience atypical symptoms that make it harder to diagnose. These symptoms include fatigue, even days or weeks before the heart attack, shortness of breath, pain in the back, neck, or jaw, nausea or vomiting, lightheadedness or dizziness. Many women dismiss these signs as the flu or exhaustion. Unfortunately, the delay in seeking treatment can be deadly. The gender bias in heart attack treatment: studies show that women are less likely than men to receive life-saving interventions, such as angioplasty or bypass surgery, during a heart attack. There's also a tendency to misdiagnose women with anxiety or indigestion instead of heart disease. This isn't just a medical oversight, it reflects a deeper bias in healthcare and research. Until recently, most clinical studies on heart disease focused on men, leaving women underrepresented in medical guidelines. The importance of knowing the risk factors: it's essential for women to understand that they may have unique risk factors for heart disease, including hormonal changes. Conditions like menopause or pregnancy-related hypertension can increase heart disease risk. Autoimmune disorders, diseases such as lupus or rheumatoid arthritis, which are more common in women, also raise cardiovascular risks. Mental health conditions, stress, anxiety, and depression, which affect women at high rates, have been linked to heart disease. Diabetes and obesity, both conditions significantly raise heart attack risks in women. If you're aware of these risks, you can take proactive steps to manage them through lifestyle changes and regular checkups. How to protect your heart: practical tips for women: know your numbers, get regular screenings for blood pressure, cholesterol, and blood sugar. Exercise regularly, aim for 30 minutes of moderate activity at least 5 days a week. Eat heart-healthy foods, focus on fruits, vegetables, whole grains, and healthy fats. Manage stress effectively, practice mindfulness, yoga, or journaling to lower stress levels. Stop smoking and limit alcohol intake. These habits significantly reduce your risk. Speak up at doctor's appointments. If something feels wrong, don't hesitate to ask for further tests. Stories that need to be heard: there are countless stories of women whose heart attacks were misdiagnosed, sometimes with tragic consequences. These stories matter because they highlight the urgent need for better education and awareness. Women must become advocates for their health, and healthcare providers must take their symptoms seriously. One inspiring example is that of Barbara, a 42-year-old woman who experienced severe fatigue and nausea for weeks. When she visited the ER, her symptoms were dismissed as anxiety. It wasn't until hours later that she was finally diagnosed with a heart attack, barely in time for life-saving intervention. Stories like these underscore why it's crucial to close the gender gap in heart attack care. The role of awareness campaigns and education: public health campaigns often focus on men when it comes to heart disease. However, raising awareness about women's heart health is essential to saving lives. This means more research, better training for healthcare providers, and outreach programs tailored to women's unique needs. Social media movements like #GoRedForWomen and Heart Health Month have made strides in spreading awareness, but there's still more work to do. We need ongoing conversations about women's heart health, in schools, workplaces, and medical settings. Heart attacks don't discriminate by gender, but awareness can make all the difference. Here's what you can do today. Share this video with the women in your life, mothers, daughters, sisters, and friends. Talk to your doctor about your heart health, even if you're feeling well. Support organizations that advocate for women's health research and heart disease awareness. Listen to your body, trust your instincts, and don't ignore unusual symptoms. Your heart health is in your hands. The more we educate, advocate, and act, the fewer lives will be lost to preventable heart attacks. The gender gap in heart attack care isn't just a medical issue, it's a public health crisis. But by spreading awareness and encouraging change, we can bridge the gap and save countless lives. Women's heart health matters, and you can make a difference. Thank you for watching, and remember, your heart deserves just as much care as anyone else's. Take care, stay healthy, and until next time. If you found this video helpful, don't forget to like, share, and subscribe for more content on health and wellness. Hit the notification bell so you never miss an update. Let's keep the conversation about women's heart health going.